Dr. Luvuyo Bayeni, Chief Director, Human Resources for Health, National Department of Health, and a stream lead for Health Workforce under the G20 Health Working Group. The last 2 days, we were hosting a G20 third meeting, as hosted by South African Presidency under the Health Working Group with a focus on health workforce. Yesterday, we dealt with issues that relate to decent work for our health workforce. And then we later on dealt with the issues that relate to advocating for investment into the health workforce. Today, we then went further to discuss the issues that relate to AI, technology, and digital health with its reference to the workforce. And lastly, we then interrogated and had a presentation that deals with the health workforce migration, inter alia, the policies that govern the space and the working of the health workforce across all countries. We can report that the last 2 days have been very fruitful and have met the objectives as set out by the Presidency as well as the Health Working Group, amongst other things, to ensure that there is advocacy for health work investment. There is equally an understanding and an agreement between the G20 member states in terms of collaborations and partnerships, especially when it comes to issues of sharing best experiences and as well as collaborating for future experiences. But the main thing that we can confirm was at the center of the 2 days was to ensure that there would be an expression of the health workforce interest into the ministerial declarations that will take place at the end of the year. And we can confirm that key to those that will appear is the issue of the health workforce investment, as well as domestic investment to enhance training, teaching, as well as the production of health workforce. Zooming into session number 3, which took place this morning, we focus mainly on digital health, technology, and AI interface with the health workforce. The discussions around the topic, amongst other things, emphasize that one, there is no intention to replace health workforce with the digital and AI space. However, the intentions that are there is to ensure that we embrace technology as it is inevitable, that it is something that we need to work with. But secondly, it is aimed at improving efficiencies, not only for the workforce, but also for the patient experience, where we are of the opinion that introduction of digital and technology as well as AI may, amongst other things, help us in terms of saving costs, but equally so give us enough time at the hands of the health workforce to be able to do efficiencies even better. We are also of the opinion that, as discussed by the member states, that there would be a decline in terms of adverse events as people will have enough time to focus on doing efficiently, so as well as being precise in terms of the work they are doing. However, there was also an indication that we would not just wish to have AI and technology when our workforce is not ready for it. So there is an emphasis to say there must equally be an investment into education that aligns with the AI space and technology. Lastly, there is also an acknowledgement that we need to collaborate as countries to ensure that even the curriculum, one, it includes digital and technological space, but secondly, there are faculties that will then focus on introducing AI as well as technology within the health workforce and the health space. And the most appropriate thing that was also endorsed was that we must be open and understand that we would inevitably open other categories of the health workforce space that will be having skills, capabilities, and expertise when it comes to the digital and health space. In the conclusion of the G20 session, members all agreed that we should advocate in terms of the investment into the technology and digital health technology space, as well as the education and training of the current health workforce when it comes to digital and technology space. We want to thank all the 19 member states that participated, as well as our international organization, but importantly, the support that was offered by Work for Health as they have deployed and assisted us through OECD, ILO, as well as WHO with the secretariat work that we were preparing with towards the 2 days that we hosted. Thank you.